Oppositional defiant disorder is a childhood disorder that is defined by a pattern of hostile, disobedient, defiant, and negativistic behaviors toward authority figures, which causes significant impairment with family, social activities, school, and work. Oppositional defiant disorder most commonly affects children and adolescents. It's more common in boys than girls. It's normal to exhibit oppositional behavior as all children will display some type of defiant behavior throughout their growing years, but a persistent pattern of anger, defiance, and vindictiveness against authority figures could be a sign of oppositional defiant disorder. ODD is often diagnosed alongside attention deficit hyperactivity disorder. Many children and teens with ODD often have other behavioral problems such as learning disorders, depression, and anxiety disorders. Parents with a child suffering from ODD should seek help from a health professional familiar with this disorder, as many times it is misdiagnosed and left untreated. ODD is often linked to more severe disorders later, including conduct disorder, substance abuse, delinquency, social isolation, and an inability to develop meaningful relationships. Many children will start to show symptoms of ODD between the age of 6 to 8 years. ODD occurs in children as well as adults. What is the difference between conduct disorder and oppositional defiant disorder? Oppositional defiant disorder is a risk factor for the development of conduct disorder. Children with oppositional defiant disorder are not aggressive towards people or animals, do not destroy property, and do not show a pattern of theft or deceit, unlike conduct disorder. Causes. There is no known clear cause of ODD. Contributing causes may include history of mental illness within the family, child's inherent temperament, chemical imbalance in brain, dysfunctional family life, family history of substance abuse, harsh discipline by parents, abuse or neglect, poverty, toxin exposure. Signs and symptoms of ODD. Signs of ODD generally begin during preschool years. Sometimes ODD may develop later, but almost always before the early teen years. The signs and symptoms of ODD will vary from person to person, lasting at least 6 months, during which 4 or more of the following are present: angry or irritable mood, failing to accept responsibility, excessive arguing with adults, especially those with authority, verbal hostility to others, refusing to follow rules, being spiteful and seeking revenge, difficulty making friends, being easily annoyed, vindictiveness, frequent temper tantrums, deliberate attempts to annoy or upset people, refuses to comply with requests and rules, having frequent outbursts of anger and resentment, saying mean and hateful things, significant problems at work, school, or home, blames others for his mistakes. And many children with ODD are moody, easily frustrated, and have a low self-esteem. They also sometimes may abuse drugs and alcohol. The diagnosis of ODD is possible only when the child exhibits 4 or more symptoms over a period of at least 6 months. Severity. ODD can vary in severity. In some children with ODD, these behaviors are only in evidence in one setting, usually at home. In more severe cases, they occur in multiple settings. A diagnosis of ODD can be mild, moderate, and severe. Mild ODD symptoms occur only in one setting, such as only at home, school, work, or with peers. Moderate ODD, some symptoms occur in at least 2 settings. Severe ODD, symptoms occur in 3 or more settings. Treatment for ODD is determined based on child's age and the severity of symptoms. Treatment often lasts several months or longer. Treatment usually consists of a combination of the following: individual psychotherapy, help to develop more effective techniques of anger management and express feelings in a healthier way. Parent-child interaction therapy helps parents and others manage the child's behavior. As a result, parents learn to increase positive interactions and more effective parenting techniques, and there will be improvement in the parent-child relationship. Cognitive behavioral therapy. This therapy helps the child identify and change thought patterns that lead to behavior problems. Family counseling may help improve communication, mutual understanding, and relationships. Social skills training helps the child to learn how to improve social skills, increase flexibility, interact more positively and effectively with peers. Medication may sometimes be used to treat other mental illnesses that may be present, such as ADHD, anxiety, and mood disorders. Thank you.